A case study. So we have Bob. He is a 55-year-old male, and 7 weeks ago he underwent a retropubic prostatectomy. He is undergoing radiation, and he has had a pelvic lymph node dissection. Additionally, he is given hormonal therapy. So what does that mean to me as a cancer exercise specialist? First off, he has to have a medical clearance form before he begins any exercise program. And because he's had a retropubic prostatectomy, that tells me that the incision is in the abdominal area. So more than likely, due to the natural healing process, the pain and fear, he will probably be bent forward flexed at the hips. So the number one thing I need to do is to make sure he can stand up straight, erect, good posture. And the last thing I want to do with respect to that particular incision is do any type of crunch type activity, which would just exacerbate that forward flexion. You can certainly begin with any type of core exercises, working on the physio ball, Bosu, foam roller, that type of thing. Okay, then we move on to the fact that he's undergoing radiation. The thing I'm concerned about there is that he would be at risk for lymphedema to the lower extremities. So that's going to kind of raise a red flag for me. When we do any lower body exercise, I need to start and progress slowly. And that means we start with body weight, which we need to be doing anyway following that retropubic prostatectomy, with just a few repetitions. Make sure that he can do a few repetitions with body weight, no problem, no pain, no swelling. Then if he can do that, then we move on to a few more repetitions with body weight. And then we gradually and in very small increments begin to add weight. Because if we do too much too fast and he gets lymphedema, we don't know at what point we overdid it. And then we've got to go back to square one. Because he's had lymph nodes removed, that doubles his risk for lower extremity lymphedema, because we are basically, for lack of a better word, we are messing with the lymphatic system by both irradiating the lymph nodes as well as removing the lymph nodes. And this is a very casual video today because I have construction going on in my house. And then, so we've got lymphedema as a concern. And then finishing off with hormonal therapy, he will have very similar to menopausal side effects. He will be at a higher risk for osteoporosis. He will be gaining weight, fatigue from both the radiation, the recovery from surgery, and also from the hormonal therapy. So exercise will play an integral part in giving him that much needed energy. He's going to need to do cardiovascular exercise, which will help to strengthen his heart and lungs, of course. It will also help to move the lymphatic fluid throughout the body, but we want to make sure, once again, that we're working out at a low intensity, not doing too much too fast. We want to begin and end each exercise session with lower extremity lymph drainage exercises and elevating the legs, doing things like foot circles, plantar and dorsiflexion, knee flexion, all with the legs elevated. Also getting him on a structured nutrition plan, working with a registered dietitian who specializes in working with cancer patients. He will have a difficult time losing the weight because of the hormonal therapy, and he will also likely get gynecomastia and breast tissue growth, which of course is going to affect his psyche as well as, his physical body.